Ever felt a fiery sensation rising in your chest after a big meal? That's acid reflux. It's a feeling that can catch you off guard, sometimes just minutes after you finish eating, or even when you're lying down to rest. For some it's a rare annoyance, but for others, it's a daily struggle that can really impact quality of life. It's incredibly common. Millions experience it daily. In fact, studies show that up to 20% of adults in Western countries deal with acid reflux symptoms at least once a week. It doesn't matter if you're young or old, busy or relaxed, acid reflux can affect anyone, anywhere. Despite the name heartburn, it's not your heart that's on fire. The burning sensation is actually happening in your esophagus, the tube that carries food from your mouth to your stomach. The pain can sometimes be so intense that people mistake it for a heart problem, but it's all about digestion. It's your digestive system, specifically when stomach acid travels the wrong way. Normally your stomach is designed to handle this powerful acid, but your esophagus isn't. When acid sneaks up, it irritates the sensitive lining, causing that burning discomfort. Your stomach uses powerful acid to break down food, but this acid is meant to stay put. Think of your stomach as a tough, well-built container, perfectly suited to handle harsh chemicals. But if those chemicals escape, trouble starts. Acid reflux happens when this acid escapes into the esophagus, a tube not built to handle it. The esophagus is lined with delicate tissue, and even a small amount of acid can cause pain, inflammation, and sometimes even long-term damage if it happens often. The esophagus is like a food highway, and acid reflux is a traffic jam with cars going the wrong way. Imagine a busy road where suddenly, vehicles start reversing and causing chaos. That's what happens when acid flows backward. The stomach and esophagus are separated by a valve which sometimes leaks. This valve, called the lower esophageal sphincter, is supposed to act like a security guard, letting food in but keeping acid out. But sometimes, it relaxes at the wrong time or doesn't close tightly enough. When the valve isn't tight, stomach contents splash up, irritating the delicate esophagus lining. That's the burning feeling, heartburn. Over time, repeated exposure can lead to more serious issues like inflammation or even ulcers in the esophagus. It's a simple case of the wrong chemical in the wrong place. Just like a chemical spill in a lab, stomach acid in the esophagus is a recipe for irritation and discomfort. Understanding this process is the first step to managing it. When you know what's happening inside your body, you can start to make choices that help prevent or reduce symptoms. It's not mysterious, it's basic biology and chemistry. The more you learn, the more empowered you become to take control of your health. By learning about the esophagus, stomach, and the valve between them, we can figure out why things go wrong. You'll discover what triggers acid reflux, why some foods or habits make it worse, and what you can do to help your body function smoothly. Think of yourself as a detective for your own body. Every symptom is a clue, and every meal or activity is a piece of the puzzle. By paying attention, you can start to notice patterns and make changes that really help. We'll examine the evidence and uncover the science behind that